Welcome to the Be Well video blog. I'm Chloe Robertson, your host. Be Well stands for Behavioral Health Wellness Environments for Living and Learning. Today on the vlog, we have with us Marc Woods, who is the Assistant Chief Nurse Executive for Behavioral Health at UK Healthcare. Hi, Marc.
Hi, Chloe. How are you?
Good. Thank you for joining us today.
Absolutely.
Our first question for you is, why is it important to address suicide prevention?
Chloe, we're in the midst of a national mental health crisis with regards to suicide. We know that suicide is the 10th leading cause of death amongst all adults, but for college-age students, that increases to the second leading cause of death. We know that a lot of this is because students typically at that age group don't take care of themselves the way that they could or should. They are also entering a stage of their life where they may be experiencing some drug kind of experimentation. Also, first time in their lives they've been away from their family. And so there's lots of new social interactions that are kind of put upon them. So they have a lot of stressors that we're not so sure that they're always prepared to be able to kind of handle.
Mm-hmm. And why is there so much stigma around suicide and prevention, like discussion around it?
So mental illness and behavioral health, for the most part, has quite a bit of stigma attached to it, has always had. And so suicide is no different. And so it doesn't mean that we shouldn't make efforts to try to combat that stigma. But it's one of those things that's attached to behavioral health, and people aren't always sure how to handle someone that they think may be suicidal. So it's one thing to know that a person's behaviors have changed, or they're maybe experiencing sadness, or they may even voice certain things that kind of let you know that they're not doing so well. The average person may not feel comfortable with talking about suicide and asking about suicide.
And what are some risk factors for suicide in people with behavioral health challenges?
So there's lots of different risk factors. Previous suicide attempts or previous kind of a history of behavioral health certainly puts someone at a higher risk for suicidal ideations or suicidal thoughts. We also know that certain groups of people experience suicidal ideation at much higher rates. We know that our LGBTQ community and our young males are actually at higher rates, a risk for higher rates of suicide.
And could you talk a little bit about the Columbia Lighthouse Project and why UK Healthcare adopted this approach?
Absolutely. So one of the things that the literature tells us is that persons who actually commit suicide or have a successful suicide, they oftentimes, about 50% of the time, have seen a healthcare provider within the last 1 to 3 months. Unfortunately, that healthcare provider hasn't always been a behavioral health provider, healthcare provider. And so the idea or the concept is that those persons are oftentimes coming into contact with healthcare clinicians. And so if we were to screen for suicide, we may be able to treat someone. Maybe they didn't come there for suicidal ideations. Maybe it's something else. But if we're screening for it, we can kind of identify it and then kind of connect that person to services. We chose the Columbia Suicide Screen, Severity Screen, for a number of reasons. The main reason was that anybody can use it. So it's widely accepted. Lots of institutions use it, and it's 3 to 6 very simple questions, and after that, it allows us to kind of triage the level of risk that patient is in from low, moderate, or high, and then give the appropriate level of interventions for the level of risk.
That's a very important project. And can you talk some about how simply asking someone if they are contemplating suicide can make a difference?
It's the most important part. So what we have to get comfortable with is saying the word suicide, asking, have you ever thought of killing yourself? If the person is interested in learning more about that, and they're not a healthcare clinician, they can go and look at the Columbia and literally just ask those questions, those 3 to 6 questions. We don't ask them simply because we might feel like the person is going to be at higher risk for committing suicide, or maybe they weren't thinking about it before, but now they are. And so that's one of the fallacies. That's just simply not true. There's been lots of studies that show that we don't increase a person's suicidal ideation simply by having that conversation. It's the single most important thing that we can do for a loved one, is to be able to have that comfort and that communication line where we can ask, are you suicidal? Have you had thoughts of hurting yourself?
Mm-hmm. Well, thank you so much for sharing this important information with us today. And thank you also for your time.
Absolutely.
If you're interested in learning more about Be Well and the behavioral health wellness environments for living and learning, check out our website at www.bhwell.uky.edu. Thanks for tuning into the Be Well vlog, where behavioral health is our priority. See you next time.